Assalamu alaikum. This video is going to be for doctors, nurses, physiotherapists, dentists and all the paramedics, for general practitioners and for specialists as well. I will compile all the steps which you need to do to get into Oman, to get a license into Oman and work there and earn higher salaries in Oman. And this video is going to be a long video, so sit back and relax and watch the whole video. And if you like it, please subscribe this channel so that I may continue improving and I may make more videos on different countries where you can work and prosperous in your future. So Oman is a very rich country and its major export is oil. So you can well imagine how prosperous and how much GDP it can have. I will discuss step by step how you can get into Oman. But first I will discuss about the salary packages which Oman is offering to different specialties, to different paramedics and to different fields of medical profession. General practitioners are earning around 1200 to 1400 Omani Riyal, which are almost 10 to 12 lakhs in Pakistani rupees, and you can convert it into Indian rupees and it will be around 8 lakh Indian rupees, and you can use Google for that money exchange process. But you can very easily say that as the dollar grows and as the oil prices increases in the world, the salary you are getting in Oman is increasing day by day. So a general practitioner is earning around 1200 to 1400 Omani Riyal. A specialist is earning around from minimum 2500 to maximum around 5000 Omani Riyal, which is a lot of money. And for nurses it's around 400 to 600 Omani Riyal. For dentists it's around 600 to 800 Omani Riyal, and for physiotherapist it's also around 600 to 800 Omani Riyal, which is around 7 to 8 lakhs, or you can say 6 to 8 lakhs roughly, as the exchange rate fluctuate on daily basis. So you can well imagine that the salaries are very high, almost 9 to 10 times as compared to which we are getting in Pakistan, and maybe 6 to 7 times which the Indians are getting in their own country, because the Indian salaries are a little bit higher than Pakistani doctors. So and also the Bengalis, this also goes for the Bengalis, but it's not for Pakistani, Indian and Bangladeshi doctors. It's for the whole world. If anyone want to move to Oman or Gulf countries from the Europe, he can earn more than he is earning in the Europe, because the salary in Oman is tax free. You're not going to give any taxes to the government because they obviously don't need it. They have a lot of oil. But in Europe the tax rate is a major portion of your salary goes into the taxes, like almost 40 to 45%. That's a big amount. When we talk about the conditions in Oman is basically have a hot weather, but there are a lot of beaches. All the major cities in Oman are on the beach area, so the weather is hot, but it's bearable. And all the buildings, all the hospitals, all the apartments are basically centrally air conditioned, so the weather or the hotness is not that big of an issue. If we talk about the living expenses in Oman, when you move to the big cities like Muscat, the rent is higher and the cost of living increases. But when you move to the peripheries, to the smaller cities, to the towns, the living expenses are lower, and maximum of your salary which is used in your daily expenses and your rental and in your bills is maximum of 30% of your pay. So you can well imagine if you are earning 1400 Omani Riyal, your maximum expense with family will be around 600 Omani Riyal, 600 to 500 Omani Riyal. So a big chunk of your salary will be saved for your future or whatever you want to do with it. Point is, you can save a major chunk of your salary while working in Oman. and that is anywhere in Gulf country you can save a lot of money, because mostly the salary is tax free, and whatever you are earning is yours. You're not gonna give it back to the government, because they don't need it, obviously. What are the steps to get into Oman? So these steps are for all the specialties, for all the general practitioners, and for all the nurses, paramedics, physiotherapists, dentists, and microbiologists. They have a lot of space out there for these specialties and for emerging fields. So the first step is to book your exam. That is a written exam, that is MCQ based. So for different specialties, obviously the study or the material you're going to study is obviously different, so you're gonna look into it separately, whatever your specialty is. So for general practitioner or whatever, for whatever specialty, you need to book your Prometric exam. For general practitioner it's Pearson View exam, but for other specialties and for nurses, paramedics, and physiotherapists, etc., it's Prometric exam still exists. So you book that exam, and in my previous videos I have shared links for the websites. I will also share the links of these websites in the description. You can use it and you can book your exam through your debit card or your credit card. And then the next step is your dataflow document verification. These two steps you can do concomitantly. You don't need to do the data flow after the written exam. You can do it on in the same timeline, and you don't need to wait for the written exam for the data flow verification. So but you need your passport obviously. So these two steps can go concomitantly, and you'll need maximum of 1 month for preparation and for data flow verification. So in a month you will complete 2 steps if you're in a hurry, obviously. But you can wait for the result of Prometric exam, and then you can apply for data flow, but it will take 1.5 month, 1 month or 1.5 month further. So that will become almost 2.5 months when you start your journey towards Oman. So the next step will be to get a job. There are a lot of platforms, there are a lot of WhatsApp groups, a lot of hospitals which are on online. You can search on the Google and you can apply in their career section and send your CVs to that hospital, and you'll get an offer, you'll get a job. After getting a job, the hospital or your employer will apply for your interview to the Ministry of Oman, and you will get your interview. Now the interview is a tricky part. Interview is a little bit difficult and trickier than your Prometric or Pearson View exam, because it is all clinical based. They'll give you 6 to 7 scenarios. There may be 2 doctors sitting there, general practitioners, and one of them will ask you and give you a scenario. He'll say, you have a patient in ER with history of chest pain. How will you proceed? So you will proceed as you do it in your emergency. What you do with that patient who present to you with the chest pain, obviously you get a little bit of history, you check vital signs, you check GCS and airway, breathing, circulation, all those steps you do it in your emergency. You will tell them, and next you will order an EKG to rule out cardiac cause. Okay, so they will whatever you say, and then exam history, and then examination, then investigations. Obviously your first investigation is EKG. They might show you an EKG and say that this is the ECG of that patient, so what is the diagnosis? So it may be as in it was in my case, it was anterolateral wall MI. So I told them, and then they'll say, how will you manage this patient? You will tell them that you will give anti-ischemics and whatever the scenario is, and you will proceed according to that. There is a separate video on this topic on Viva, but it's in Urdu, so I might made my next video in English on just purely on Viva part, because it is a tricky part. So the main thing is that they will give you scenario. the common scenarios which you usually encounter in your emergencies and in your outpatient departments. So they will proceed on that, but those will be 5 to 6 scenarios, so it's gonna be a tricky and a difficult one. So when you pass your viva, then your employer applies for the work permit. It comes in around 5 to 4 working days, and then they'll apply for your visa, and it takes around 2 to 3 weeks for your visa to arrival. It depends on how much in a hurry your employer is, and how much active he is, how eagerly and urgently he wants you there in his clinic. So that's gonna be around the whole process will take around 1 month, and bam, you are in Oman. Now they will provide you visa free of cost. They will provide you ticket, and most of the contracts involved in these jobs involve accommodation as well. As I got the free accommodation, and they'll provide visa, they'll provide ticket, and they'll provide annual return ticket to your home country with the 1 month extra, with 1 month paid leave. So it looks like a pretty good deal. Why you should move to Oman? It depends on you. It's purely your decision. It's if you're gonna get out of your comfort zone, and because most of the time we are doing 2 to 3 jobs in Pakistan, and I think Indians doctors also do at least 2 to 3 jobs to maintain their lifestyle, to earn that much money that they can sustain their lifestyle, and they can get a house, they can get a car, and they can get their children to school. So but if we talk about the saving part, that's very less, that the chances of saving the money is pretty steep. This is a good opportunity. You go out there, you earn money, you send the money back into your country, which will help your country to increase the revenue, and maybe someday things will get better and you will come back as stronger as before. This is all. I hope I have covered all the parts to all the steps to get into Oman, to get your license to practice in Oman. And lastly, I would say that there is a lot of space for the general practitioners, for the specialists, because in Oman their own doctors are a little bit less. They don't have that much medical colleges, but they are because the rich, obviously the GDP rate is very high, so every person out there is very important, and they want a good and a best quality medical services for their nation. So they are increasing number of doctors, they are increasing number of hospitals, and there are a lot of other areas to work as a doctor, because on construction sites, on oil refineries, they do hire doctors 24/7 so that their employees or their workers can get a good and quality healthcare services at their doorsteps. Thank you so much.